Hi family, welcome back to my channel. So if you are new, welcome. If you are an old subscriber, welcome back to my channel. So if you already saw by the thumbnail, today we are talking about postpartum euphoria, the most not talked about depression after childbirth. So this is the type of depression that nobody talks about. So if you just joined my live, please don't forget to like, comment, and subscribe. Thank you so much. Hi, Postpartum vlog. Welcome to my live. Thank you so much for joining. Please don't forget to like, comment, or subscribe. All right, guys. So, postpartum euphoria. So this is the most not talked about depression after child. Excited, extremely excited, happy or overjoyed after having a baby. So if you don't experience any of these signs, then you may be going through postpartum depression. If you just had a baby and you don't feel happy like you should feel, it's normal and it's expected for you to be very happy, for you to be overly joyed, for you to be excited after having a baby. So if you don't experience any of this, you may be going through postpartum depression. It's normal to be happy after having a baby you've carried and grown for 9 months. Gosh, it feels so supernatural. I mean, it feels so supernatural to carry a baby for a whole 9 months, to grow the baby in your womb, to have such a strong connection with the baby, fall in love with the baby even before the baby is born. It's very natural and it's very supernatural after this experience. So it's very normal and expected for you to be overly excited, overjoyed, and happy. So if you don't experience any of this, you may be going through postpartum depression. However, in some cases, feeling intensely overjoyed and happy could be postpartum euphoria. However, feeling overly joyed, intensely happy could also be postpartum euphoria. You may have heard about postpartum depression, but not postpartum euphoria. Postpartum euphoria, I don't think you've heard about it. Many women, like, it's really happening. About 50% of women go through this after childbirth, but nobody talks about postpartum euphoria. We always hear about postpartum depression. Although not people don't talk much about postpartum euphoria. Postpartum euphoria is also known as baby pains. Like in postpartum depression, I talk about baby blues or postpartum blues, but this one, postpartum euphoria, is also known as baby pink. So postpartum euphoria can cause boundless energy, extreme productivity, and burst of happiness. Most women grow an energy which cannot be explained after having a baby. You may find yourself reorganizing your baby nursery closet after having a baby. You may also have trouble concentrating. So if you experience any of this, you may be going through postpartum euphoria. So it's very tricky for you to be able to know if you're having postpartum euphoria or if you're going through postpartum euphoria. The reason is it is expected for you to feel the way you are feeling. Like the symptoms I just mentioned, it's very normal. It is expected for you to feel the way the things I just mentioned right now. Like I said that you may find yourself reorganizing your baby nursery or closet after having a baby. You may also have trouble concentrating. So this is something that normally happens after having a baby. Some women feel so overjoyed, they feel so happy that they start reorganizing. They start reorganizing their baby's closet, their baby's nursery after having the baby. So it's very tricky to know whether it's postpartum euphoria or it's just normal. This condition is not well defined or understood. It's expected. Experiencing this baby pains for few weeks could be normal, but they may also be something to be concerned concerned about. Experiencing this for few weeks could be normal, but there may be also something that you should be concerned about. It can be a sign of a more serious mental health condition. This could be a sign of a more to it. So this is what is postpartum euphoria. Postpartum euphoria. What is postpartum euphoria? Okay. Postpartum euphoria is a constellation of symptoms which includes intense happiness and excitement, an increased excitement or increase of energy. Postpartum euphoria is a constellation of symptoms which includes intense happiness or excitement, increase of an energy, and difficulty in concentrating. It usually occurs in the first couple of weeks after giving birth. So this is like postpartum blues, which also usually occur after few days after giving birth. Okay, this is similar to postpartum blues. Like I said, this baby pangs or postpartum euphoria may occur for days and quickly pass away. So that's the good news about it. Postpartum euphoria may come or may occur for few days and then quickly pass away. So that's the good news of postpartum euphoria. Postpartum euphoria could be a precursor to postpartum psychosis. Postpartum euphoria could be a precursor to postpartum psychosis. This condition involves severe and intense manic episode. This condition, which is the postpartum euphoria, involves severe and intense manic episodes. According to research, up to 50% of women who have had a baby experience postpartum euphoria. About 50% of women who have just given birth to a baby or who have just had a baby experience postpartum euphoria. In 5 days after childbirth, right in 5 days after you give birth, you are likely to experience postpartum euphoria. It is estimated that far fewer parents actually go on to be diagnosed with mood disorders. 5% diagnosed with postpartum bipolar disorder. Postpartum bipolar disorder. So bipolar disorder can also, a woman who have just given birth can also have bipolar disorder. Studies also shows that 0.1 of people who have given birth develop postpartum psychosis. Like I said in my other live video, I said that about 1% of people go through postpartum psychosis, but postpartum euphoria, about 50% of people go through that, and postpartum depression, about 75% men go through that. Okay, so this is not commonly found. About less my connection as usual. The last time I went live, it's not good at all. So we are going to talk about the dangers of postpartum euphoria. In many cases, symptoms of postpartum euphoria pass without further issues. Like I mentioned earlier, you will experience an elevated mood for a few days post-birth and bask in the glow of life with baby. But if symptoms persist and become more manic, they may potentially be a precursor to postpartum depression, which I already mentioned. Postpartum bipolar disorder or postpartum psychosis, all conditions that require treatment. In fact, up to an estimated 1 in 3 women who are treated for mood disorders in perinatal clinics are believed to also have experienced postpartum euphoria, according to research. So I think the postpartum euphoria starts and then it leads to, if it's not treated, it may lead to postpartum psychosis or postpartum bipolar disorder. Postpartum psychosis is a mental health disorder that remain undiagnosed and untreated, and it can pose risks to both mom and baby. in condition to impacting your quality of life. All these conditions can make it more challenging and bond with baby. It's harder to give more of yourself to your infant and to your family. Infants do need these close relationships. Infant needs these close relationships that serve in return interaction to really help support your newborn cognitive development. Postpartum bipolar can also increase your risk for suicidal ideation and self-harm, which I already mentioned. I think recently I just shared a video in my community board, which I think is very important. A lot of women are going through this and they are not talking about it. They keep it to themselves and it gets worse. And they start having ideas of harming themselves, committing suicide, and so many others. And manic episode can lead people to take risks that pose dangers to their health. They can go on massive shopping sprees, like it's very intense. They need to go on a shop. Please forgive me about my connection is very bad. Now let's go to causes of postpartum euphoria. Research suggests that pregnancy and childbirth, that constant onslaught of physical and emotional changes, we know that there's a whole lot of physical and emotional changes in pregnancy. I said in my other live video that pregnancy itself is very psychological, and postpartum also is very psychological. And not only your mental health that changes, is also your physical health also changes. So make people more likely to experience mental health conditions during pregnancy and after birth. Postpartum mood disorders are thought to be related to the large hormonal fluctuations that occur in the postpartum period. Postpartum mood disorders are thought to be related to the large hormonal fluctuations that occur in the postpartum period. There also is a strong genetic component to postpartum mood disorders. Having a personal or family history increases your chances of having postpartum mood disorders. Unfortunately, you may not always realize that a family member had a postnatal mood disorder. Since people shy away from discussing these conditions or don't recognize the symptoms, which is also very important for you to recognize the symptoms. Sometimes people can go undiagnosed, especially if it's some more subtle symptoms, like if it's just a normal symptom, a mild symptom, they can go undiagnosed. In some cases, hypomania-like symptoms can appear because of an overactive thyroid. A thyroid disorder that often involves thyroid. An estimated 5 to 10% of women experience postpartum thyroiditis. If you only get the up and you don't have any of the down, then that will probably be the first thing I want to rule out. Like if you have had the up and you have not had the down of these symptoms, and the reason why you experience this mild symptom is just, it comes, like I said earlier, it comes and it goes, but some may seem normal and some may seem more severe and needs immediate attention, which is why you should always consult your doctor to be diagnosed. Though it cannot medically be diagnosed, your symptoms may help the doctor to assess and give you medication. Signs and symptoms of postpartum euphoria. Impulsivity. You become so impulsive. Impulsivity is one of the symptoms of postpartum euphoria. Raising thoughts, difficulty in concentrating, being easily distracted, increased activity or energy, requiring a less sleep than usual. So this is somehow related to postpartum psychosis, which you don't feel the need to sleep or you sleep a lot. Rapid speech, feelings of euphoria, extreme happiness, like you feel extremely happy. I don't know if you've seen someone who is on drugs, like if you watch movies and people do drugs, you can see that they feel extremely happy, but it's because of the drug, right? But in postpartum euphoria, you feel extremely happy, some maniac way of happiness, although you are not on drugs. It may seem like you're on drugs, but you're not. It's postpartum euphoria. Like if you experience it after childbirth, it's postpartum euphoria. Or if you are experiencing a hypomanic episode or irritability. It's important to note that you can experience symptoms of hypomania or euphoria and symptoms of depression at the same time. You can experience all three at the same time. In many cases, postpartum euphoria symptoms last for just a day or two, like I mentioned. However, if they continue for 4 days or longer, your healthcare provider may diagnose a hypomanic episode. Doctors may diagnose a manic episode if you experience like doing step aerobics or right, like when it comes to postpartum euphoria, if they're not doing house chores, you may like around something which is not really normal for you, whom you think is going to comment below. I want to know if you can hear everything I'm saying. My microphone comes and goes, so I don't know if it's really working or not. Please let me know. Please let me know in the comments. If you can hear it, please comment below, and if you cannot hear it, please comment below and let me know. Okay, so let's go to what you should do if you experience or if you think you have postpartum euphoria, or if you know someone that have postpartum euphoria, like if you know someone who have been going through the symptoms I just mentioned. Excuse me. If you are experiencing postpartum euphoria, or if someone you know, someone you love, your wife, your sister, or your mother is experiencing the postpartum euphoria symptoms for a couple of days, or if you experience symptoms of depression after a period of postpartum euphoria, it's important to see your doctor to rule out more serious mental health conditions. Moms and their loved ones should be on the lookout for sudden and extreme changes in behavior. Whether you need to seek help has to do with the persistence of the symptoms and the degree to which they affect your functioning. Okay, Xian Ngojen, Vietnam. Okay, thank you so much for joining. Thank you so much. For example, you may not need to see your doctor if you are more talkative and don't need as much sleep, but you are otherwise behaving and functioning normally. If you, however, you start speaking so rapidly like nobody can understand you, and you are not sleeping at all and are not able to function as a mother or a worker or a partner, then there is a problem and you must see a doctor immediately. Because postpartum euphoria symptoms have been linked to a future PPD diagnosis, it's important to keep an eye out for symptoms of depression, including feelings of worthlessness or guilt, loss of interest or pleasure in most things you used to enjoy, and depressed mood most of the day. So this leads to postpartum depression. Postpartum euphoria leads to postpartum depression. And I think all the things I just mentioned here, you heard in the other live video about postpartum depression. So treatment for postpartum euphoria. Treatment for postpartum euphoria depends on the intensity and the duration of your symptoms. Treatment of postpartum euphoria depends on the intensity and the duration of your symptoms. A few days of postpartum euphoria symptoms that don't escalate may not require treatment. If you just had a few days of postpartum euphoria, then let me remove the microphone. Okay, now the network is wow. Okay. Hey guys, please don't forget to like, comment, and subscribe. So, like I was saying, if you have a few days of postpartum euphoria symptoms, then it doesn't escalate or may not require treatment. Postpartum bipolar disorder or PPD may require psychotherapy or medications, including mood stabilizers, atypical antipsychotics, or antidepressants. Postpartum psychosis treatment often involves hospitalization. experts strongly recommend lifestyle changes for treating all types of postpartum mental health conditions. This includes exercising, establishing a regular bedtime as much as possible with a newborn, and eating healthy meals throughout the day. If your insulin gets out of balance, that can cause some other negative symptoms. Please let me repeat this again. Experts strongly recommend lifestyle changes for treating all types of postpartum mental health conditions. This includes exercising, establishing a regular bedtime as much as possible with a newborn, and then eating healthy meals throughout the day. If your insulin gets out of balance, that can cause some other negative symptoms. Sleep disturbances are one of the biggest triggers for mania or hypomania in people who are vulnerable. So loved ones can support a new mom's mental health by helping her to get more sleep. Watching babies so mom can sleep longer stretches, even if she's breastfeeding and can't sleep for a full uninterrupted 8 hours. So a new mom should be able to. Okay guys, my network again. So please let me know if you are a new mom and you were able to sleep for 8 hours in the night. Let me know, because your baby wake up about 5 times in the night. But it's required for the new mom to get about 8 hours of sleep uninterrupted. So if loved ones and family and husband will be able to assist the mom while the baby wake up, so the mother can get 8 hours of sleep, which is very important. A new mom's cycle can bring these symptoms to her attention and monitor them, as well as encourage her to read up on postpartum bipolar disorder and visit a doctor if symptoms persist. Suggest contacting Postpartum Support International. But if you are in Africa, I don't think there's something like that here. So you need to go to the hospital to be diagnosed or assessed, and you'll be given medication, or you'll be given a psychotherapy or antidepressant to be able to help with this. So guys, this is where we will end here. Thank you so much for joining me. And did not make another time, but Mom be some per se. Michelle said you see YouTube and batch madarama. If who want the open say we now per se, me mount guidelines in Saneman dia medipe mount. Na say we now be when say ade bia unim hu bibia any kwan say we untimi nya so kra enye. If anything at all, ade bia open say utimi ye unim ye bia per say we bia na say bia guidelines, they are fine. Before say me best start say me ye home research pa ade bia say we have anything at all that you want to do, I'll be able to give you about it. So all you need to do, just tell me, ask me, see me personally, I'll be able to help you with it. Thank you so much, guys. Adebia we be I said no no Adebia say 3 hours say Adebia anything at all. And as well we be school now when you do man and say be oh knowledge now course now quite yourself we shall be and also you can start with it. The here say oh best start here more knowledge. Yes, say knowledge is power. So thank you family so much for joining me. I believe this was very educative. Thank you so much. I love you guys so much. I'll see you in another one.